Myself Sayan Pal, Assistant Professor of NSMS Institute of Pharmacy. Today we are going to discuss about regulation of hypertension. So, hypertension is systemic elevated blood pressure which is sustained for long period. Hypertension mainly are divided into two types: essential hypertension and secondary hypertension. In case of essential hypertension, there is not well defined cause of hypertension, and in case of secondary hypertension, there is a disease which trigger hypertension. If we remove the cause of disease, then hypertension will gradually moves down. Then in case of management of hypertension, we first if a patient come with mild hypertension, then we should try non-pharmacological method of hypertension, like potassium rich diet, taking potassium rich diet, then regular basis of exercise, then salt restriction, avoid smoking, restriction in alcohol consumption, mind therapy. This will reduce the mild hypertension. And then before going into the regulation of hypertension with pharmacological method, we should know the factor which regulate our blood pressure. So there are mainly two types which will control our blood pressure, like blood pressure mainly regulate by our cardiac output and total peripheral resistance. The cardiac output mainly divided into two parameters, stroke volume and heart rate, and then some major factor like sympathetic nervous system, overactivation of sympathetic nervous system, overactivation of RAS system, renin-angiotensin aldosterone system, overactivation of beta 2 and alpha receptors. These things will regulate our blood pressure. So with the drugs, if we modify these parameters, we can control our blood pressure. So some drugs, pharmacological drugs which are acting in central nervous system, like centrally acting sympatholytic drugs. Example are clonidine, alpha methyl dopa. Then nerve-ending, sympathetic nerve-ending blocking drugs like metyrosine, guanadril. Then beta blockers like propanolol, atenolol, carvedilol. Then alpha blockers like pyrazosine, terazosin. Calcium channel blocker group of drugs like verapamil, deltiazem. Angiotensin converting enzyme blocker like captopril, enalapril. Diuretics like furosemide, thiazide group of drugs like chlorothiazide, hydrochlorothiazide. By using these drugs, we can control the parameter which regulate our blood pressure. Thank you.